who is our Chief Engagement Officer. We're also always thrilled to be joined by a number of our other colleagues from the National Runaway Safe Line who are certainly here to also answer any questions and to provide support. But I'll just have them just give a quick wave. Sam Gillis is joining us as our Chief Program Officer. Shanae Weems is on as our Director of Training and Quality Assurance. Catherine LaBelle is, I'm gonna always screw up her title, but she is the Digital Media Communications Coordinator, guru of everything, who actually makes everything happen. So she is here, and I believe Maria Taylor is on somewhere as well, who is our prevention and youth engagement, prevention, outreach, and youth engagement coordinator. So she is on. If I have missed anyone, I apologize, but let's get going and jump in. Again, we're gonna spend the time together sharing information about what we do, some other information and resources that we thought would be helpful, and then highlight some key ways and opportunities for us to work together. So we're going to move on, Catherine, to the next slide here. So just to give you a sense of who we are, if you are not familiar with us or you're just getting to know us a little bit better, the National Runaway Safe Line is an organization. We are a wholly subsidiary, 501c3. Our organization has been around now. We're celebrating 50 years as an organization this fall, which we're very excited and proud of being in that position. We are based in Chicago, but serve the entire country. And we've been based in Chicago in the same neighborhood throughout the duration of our existence. We do serve as the federally designated national communication system for youth in crisis, runaway, and homeless youth. And our focus and as our mission is to keep America's runaway, homeless, and at-risk youth safe and off the streets. On average, NRS makes approximately 125,000 connections to young people, families, and service providers offering help through our hotline, online, and other offline kinds of resources, much more of which we're going to get into the detail and share more about as we move forward and move through our presentation today. So to give you a little bit of a highlight of some of the things that we offer, if we're going to move on to the next slide, just to give you, again, this sort of high-level overview, we do operate our crisis hotline, which is our 1-800-RUNAWAY number, as well as we provide our services and crisis services and support through 1-800-RUNAWAY.org. So our range of crisis services are sort of made up of a collective of phone, email, chat, and some texting, which will be enhancing and bringing more to you later this year, which we will be excited to tell you more down the road. But our services essentially are trauma informed. They're focused on providing solutions, crisis intervention, immediate support for young people who are reaching out for a range of needs, a range of services that we'll get into more additional detail. We offer a number of other services and supports through information and referrals, message servicing, conference calling, and our home-free family reunification and transportation program, along with offering via our website and through materials that you're able to order and access that are focused on education, outreach, prevention, and all kinds of promotional resources and materials that can be used in your own programs and in your own communities. So just to touch a bit, to provide a little bit more in-depth detail about the kinds of referrals and services and support that we provide. One of the things as the national communication system and the role that National Runaway Safe Line plays is in many ways we serve as a conduit and a connector. So we are here as a national organization that's accessible and reachable by young people, families, and service providers across the country, 24 hours, 7 days a week. And in doing so, we also maintain a national database that contains over 6,500 names and access to agencies, service providers, and resources. So we're able to serve, again, as that connector to that information. And this database is comprised of everything ranging from shelters, different kinds of other service providers, child protection information, the partnerships and links to other national hotlines and other partners at the national level that we work with, legal information, counseling, law enforcement, things around medical assistance and health services, residential treatment, substance abuse treatment, sort of essentially most things that young people might need or family might be in need of at the local level. Our goal and our focus is to ensure that we're providing the information about those resources and making those connections so that young people and families have what they need where they are and in their own communities. And then just to give you a little bit of a sense, just in 2020, we made roughly 16,000 crisis contacts that resulted in at least one referral that was provided across the US, and then 20,000 or roughly 21,000 total referrals in 2020 that our staff provided to young people and family members and or service providers who reached out and connected with us at the Safe Line. So that is just the beginning of what we have to offer. I'm going to turn it over to Jeff, who will go in depth into more of what we're doing.
Yeah, thanks, Susan. What we thought would be good here as well would be to go into just a little bit more depth in a few of those services that Susan mentioned that we offer, so you have a little bit more detail. As Susan said, the message service that we offer through our hotline at 1-800-RUNAWAY. Very briefly, the idea of this service is, like all of our services, that there's confidentiality. But what we see a lot of times is that this message service is a preferred service because it offers a way to communicate, whether it's with guardians, family members, in an indirect method to let people know that you're safe, and maybe getting closer to direct contact, even if direct contact isn't necessarily the goal just yet. So it often is a good stepping stone that we see along the way through our hotline that we can facilitate, and that is used a lot of time. And the hope is that it will lead to a conference call or some other more direct form of conversation. And again, what this allows us to do, it allows the youth to leave a message for parents, guardians, in case a parent or a guardian were to check in with us and see if we've heard from the person, their loved one, and vice versa, where a parent or a guardian could leave a message for a youth, and then the youth check those messages as well. So an initial indirect step. Next slide, please. And as I said, the goal would then be hopefully to lead to a more direct form of communication. And a conference call is one way that we can facilitate that through our hotline. And the idea is that one of our NRS volunteers or staff members who's trained can serve as a mediator, oftentimes representing the youth in a conversation with their parent or their legal guardian. We see a lot of times that it can be hard for youth to express themselves as fully as they would like and to feel like they're truly being heard. So it can be really helpful for a representative to serve as a mediator to ensure that both sides are being heard and to help youth especially articulate their messages to loved ones in hopes of finding resolution and bringing these two groups of people together. So conference calls then becomes a more direct form of communication. And then on the next slide, a program that we're very proud of, and I see one of our board members, Adam Manlove, who is an employee at Greyhound, who is so influential in this program, is on this call today. Our Home Free program is a program that we love and that we really value for how successful it's been and continues to be. This program was established in 1995. We work with Greyhound Lines, Inc., and the goal is essentially to reunite youth with families or their legal guardian, or if that's not where they feel is the safe place for them to travel, to help them get to an alternate living arrangement to find a place of safety and to get to their next step And the way we do this is to work in partnership with Greyhound and organize with them a free bus ticket to get them to their destination. So this can be within a state, this can be well across state lines. We've seen this basically go cross country. We've seen this, there can be a lot of complicated elements to this in terms of sorting out details for transit points and hubs and getting youth meals while they wait from one bus to another. There's a lot that goes into this, and it takes very careful coordination with Greyhound and NRS with local entities in different cities to make this come to fruition. And usually that happens within 24 hours. The program's available for youth between 12 and 21. For youth 17 and under, there's also the opportunity for a ticket for somebody else. So, if somebody is 15 years old, wants to travel across state lines, let's say, a parent might be able to first take a bus to the youth, and then they transit back together for safety's sake. In 2020, as it says, 305 youth traveled through the program alone. And since the program's inception, approximately 17,000 youth have used this program, with even those numbers even higher if you include parents and guardians who have supported this program and been part of it to be part of the transit process. So that's just a little bit more about these individual programs. The next thing we're going to do is I want to hand it back off to Susan, and we're going to talk a little bit about some of the data that we've seen over the past year.
Okay. Jeff, it's good. I'll jump into it. I thought I was taking the COVID part.
Oh, sorry. You're right. I apologize, Susan. This
Do
is
it, or
my bad.
we can tag team.
We did talk about a tag team, and I just had it different in my head. Yeah, this is still me. Sorry, everybody. Good thing we all know what we're talking about here for sure, at least. Yeah. So we have collected our data from 2020, and we've started to put this together. We've tried to show this, and we wanted to present to you a bit of a snapshot of what the last year has brought, and of course that is particularly interesting thinking about COVID over the past year. And as Susan said, as I get through kind of this overall stats, Susan will dive into some stuff related to COVID specifically, which is very interesting, I think you'll see. There are some things that are notable about our services and who reaches out to us. As you can see, when we break it down by gender, certainly female heavy. Nearly 70% of folks who reach out to us are female. Age range, we also see this, that this is pretty consistent, that in the 15 to 17-year-old category, those are the youth who reach out to us the most. As Susan, I'm sure will point out, related to COVID, we have seen an increase in the number of youth who are under age 12 who have reached out to us. So that's pretty, I think that's an interesting thing to have noted along the way. Race, about half the people who reach out to us are Caucasian, and about 20% are Black or African American, and different populations. And certainly when we see different demographics of folks and thinking about where we can serve folks who might be in underserved populations, this has led to us being very interested in creating new partnerships. So for example, we've worked with a group in South Dakota recently in hopes of supporting them, especially with Native populations in that part of the country. So if that's something that sparks ideas as you hear this, that's great. And then as you see here, some of the states with some of the highest crisis contact volume. Some of these perhaps are not a huge surprise in terms of the size of the physical size and scope of the states. California, Texas, Florida, New York, a pretty big state. Illinois is our, technically our home state since we're headquartered here. So I think that certainly has something to do with it, and Georgia notably as well, kind of our top 6. And we certainly, as we'll talk about later, we can get you data on where your state might come into play with this if this is something that interests you. Next slide. So this is a look here at crisis contact data and where youth were when they were when they reached out to us. So as you'll see, this is based on, it says 25,800 crisis contacts. All of the data that we collect related to this and the data that you saw on the previous slide, I should note, is voluntary data that is offered through these calls or these chats. So the number of data points that we have for each of these stats is different depending on what folks offer along the call. What I think is very interesting here, and again, we'll highlight this in future slides here, but as you can see, I want to point out the biggest pieces of this puzzle on this slide. 36% are contemplating running away, and 41% are in crisis. That does not necessarily mean that they have left home. So that encapsulates right there, what, 77-ish% of the folks who you see who reach out to us. In many ways, I like to say this does really highlight the importance of prevention and the work that we do in prevention, not just in crisis services for folks who may have left home, but crisis services for folks who may be considering leaving home, but maybe are reaching out to us before things get to what I sometimes describe as boiling point. So I think this is a notable point that 13% have already run away, 7% are homeless, 3% asked to leave, but the vast majority are not necessarily in that situation. Next slide. So these are our top issues that were raised, and you'll see this is more folks offered this data than in the previous slide. There's just one thing really that one big thing that I want to note. There are obviously subcategories that we collect within each of these points of data. So family dynamics incorporates a lot of things, whether it's trouble with step families, whether it's divorce, things like that. And we have different categories that people might specify when they reach out to us. Abuse and neglect, peer and social issues. What I do want to point out is mental health. And I know Susan, again, will get into this related to COVID, but this has grown for us. The number of, the percentage of people reaching out who cite mental health as a reason for their reaching out, that has grown. And again, I think COVID probably has a good amount to do with that, with people potentially being stuck in situations that can be very stressful, and not being able to leave situations that could be, whether it's stressful, whether it's potentially dangerous, having trouble over the last year to get out of situations that might be problematic. So certainly the mental health is the one that I think is the most notable here. Obviously, all of these are extremely important to mention: abuse and neglect, peer and social issues, but we have seen these in these kinds of numbers before. The mental health is something that seemed to be on the rise for us. And on the next slide just shows where youth were when they reached out to us. And the thing I really want to point out on this slide, which I kind of hinted at already, is the bottom right corner where it says 71% of the youth who connected were still at home. And this goes back to the point I made earlier, that our prevention efforts, we're really proud of the things we offer for prevention, which we will continue to talk about throughout in future slides here, some of the things we do for prevention and education. But people are reaching out to us for crisis services, not just when they are no longer home, or they have run away, or they may be homeless. They are reaching out to us as a resource to listen to them, to offer feedback, hopefully before things reach that point, to find other ways to find safety, potentially before homelessness comes to fruition for them. Homelessness, we find, tends to be, or running away tends to be, a last straw. It's not something that's chosen for folks. So we want to be seen as a prevention resource and a prevention tool, and the resources that we can offer to be that tool. So Susan, I promise now we're up to the stuff that was intended for you. Sorry about that. And we're on to talk a bit about COVID.
That's okay. Thanks, Jeff. I appreciate it. And what we wanted to do, which makes a lot of sense and will continue to take a further look and further analysis, both at 2020 and in 2021, as I'm sure many of you are as well, as we work to understand not only the impact during the height of the pandemic in 2020 on the young people we serve and the families we serve, but also wanting to really understand the ongoing impact and the shifts and adaptations that as an organization that we may need to continue to make, may need to continue to understand more deeply and shift to provide that kind of support. But when we took a deeper dive and looked a little bit further at our 2020 information, there's just some key things that we think really were an impact or a direct impact from COVID-19. And I think it's important just to share those out. So as Jeff had noted around the rise in mental health related concerns, prompting both reaching out to us at NRS, but just in general, things that young people were experiencing. We cited here, roughly 9,000 young people who reached out to us during 2020 cited mental health as a reason for contacting us. What I do want to note is that doesn't mean that it was only exclusive to these 9,000 young people out of the 125,000 plus that reached out to us. It's more so that these may be the young people who had self-reported or cited that as a specific reason for reaching out to the Safe Line. Why it's also so critical is in previous years, really looking back almost a decade, mental health had not only not been in our top 3, but had rarely even been in our top 10. So certainly something that we think is going to be important to pay attention to. Some other things though that are more specific, we saw this 8% increase in contact citing emotional or verbal abuse as a reason. Again, we think it's directly related to some of the things that were already noted by Jeff, but just important for us to keep an eye on and to really understand that impact going forward, as well as for us, a 4% increase in contacts citing physical abuse as a reason for that contact. Simultaneously, we then have also seen on our end an increase in the number of abuse and neglect reports that we were filing on behalf of young people. And sort of anecdotally, we'll have to take a look at this a little bit further as we can, but we were seeing more than we had normally experienced of founded or open cases that were being opened as a result. So we saw a slight, again, no surprise in 2020, an uptick in the number of home free tickets that we issued, and as well as an increase in the number of contact citing financial reasons for reaching out to us. So this is just a way to give a kind of understanding and a picture of what we were learning. And I think it's not that inconsistent with what we're seeing kind of across the board among different kinds of agencies and different kinds of communities working with and serving young people. It just sort of reaffirms the issues that we need to be paying attention to as we move forward together. But as we move to the next slide, I just want to kind of talk about some other things that we felt. Why were we seeing these? And then how do we think about it? How did it both influence what we did as an organization and changes and shifts we've made to adjust, but how do we think about it going forward? Some of these, now it seems so far long ago that 2020 was, even though it was only, a little less than a year ago, but certainly we saw some of the dynamic shift and change. And some of the challenges is the result of a limited to no availability of shelter resources. Of course, this is shifting back and things are changing, and this is a very fluid process. We did really see a continued and regular emphasis and increase in limited to no access to transportation for safe housing and shelter. This is something that has also, though, been an area of concern and an issue and challenge that we feel very strongly about, that we will continue to need to address, to look at the importance of the partnership we have with Greyhound, but also other transportation options and opportunities as we move forward in the work that we're doing. We certainly saw how critical the connections are to the support systems that typically exist and are offered through schools, as well as things like drop-in centers, case management and other resources as maybe these things were curtailed more or shifted or access to them changed as a result of COVID. Again, as we're seeing sort of the world open back up and things are shifting, we still know that how these services are accessed, how they're delivered may have changed. For us, for example, some of the changes we've made, we would certainly say many for the better. I'm sure that that's, again, consistent across the country, but things that we have to pay attention to and pay attention as we're working around addressing the issues and challenges that face young people facing difficult situations or facing homelessness, how important the role that things like schools play and the people connected to those schools play in their lives. And then finally, which Jeff has touched on kind of a number of times, with people more confined, more difficult living arrangements and situations, particularly during the height of the lockdowns, we think this certainly influenced our numbers as well. So just to kind of give you a sense of some ways that at the National Runaway Safe Line that we responded to these shifts and these changes and some of these challenges, some of which were a bit more inward focused and much of which may have been inward focused, but allowing us to better serve the communities that we work with. So we, over the course of 2020, integrated and updated our entire sort of technology base, which allowed our organization to go fully remote, which sometimes when we sort of say, well, we're a crisis hotline that nobody actually ever sees normally in an office space, for example. But what this did was, one, it allowed us internally to keep our staff safe and sort of address the various restrictions that were occurring in our communities. But also what it's done is it's allowed us to create more opportunities, more ways that we might be able to incorporate volunteers from across the country and other ways to provide our services now on a much more robust kind of technology-based platform. So while many of you may not see that sort of the physical, value of that or experience it directly, what we feel like it's done is it's really significantly enhanced and improved our capacity and our operations, and quite frankly, our ability to respond much more quickly to the contacts that we're receiving, which is all good from my perspective. We really focused on expanding and updating our resource and referral database, focusing not only during the height of COVID, trying to really stay on top of and be a resource on what was sort of happening across the US, but also really recognizing as a result the kinds of shifts, the kinds of changes that we have to ensure that we're providing access to, keeping apprised of, making sure again that we're enhancing things like mental health referrals and organizations and things of that nature, but really making sure that we're addressing what we're hearing from people in terms of what they need, and then reflecting back and making sure that they can connect to those services, supports, and whatnot. So what we also have done is taken a complete and very purposeful look at how we support the physical and mental health and well-being, particularly of our entire team at the National Runaway Safe Line, but certainly our crisis services team members as well, which we think then helps to influence and improve the capacity of our organization to provide more services and support to ensure that if we're taking care of others, that we're also taking care of our own team members, and doing that in such a way that we hope that we reflect the kind of organization that we not only want to be, but the kind of organization that we should be in terms of the ability to best meet the needs of young people as well. And then finally, we've really, really increased, enhanced, and ramped up the kinds of outreach that we're conducting through our website, through social media, all of our outward facing, engaging ways that we're providing access to services, information, and resources. We have spent an enormous amount of time and effort, and hopefully many of you will take advantage of those services and access to resources as well. So just to kind of quickly move through, Jeff touched on one of the key things that is really important to note is that number, 71% of youth who are connecting with the Safe Line are still at home. This provides this not only the Safe Line with all kinds of opportunities around prevention, but we feel it's really important for us to look at those opportunities then and how we build relationships and partnerships at all levels in order to work collectively across the continuum, focus on preventing runaway and homeless episodes for the young people we're serving. So just a couple of key highlights on the kinds of activities and prevention strategies that we are focused on. Certainly around community education engagement. You will see we have just a plethora of resources available via our website, all of which is free, ranging from blogs, tip sheets, other kinds of resources highlighting the different issues that are impacting the young people that we serve. We will get into it a bit more later, but we have a library of materials that are also both downloadable, but that you can access and we can send. Again, all free of charge. We are very focused. We're one of our signature efforts around prevention is leading an annual national awareness campaign, the National Runaway Prevention Month that takes place every November. Again, we'll get into more detail, but are super excited for what's coming up this fall. Our Let's Talk prevention curriculum, which Jeff is going to take a deeper dive into, is a free curriculum that is module based, easy to download, easy to access, easy to use across all kinds of organizations and with a range of different populations and groups of young people. And then finally, we really feel like our prevention focused on the Home Free program and really recognizing the critical link that transportation and access to be able to return to or get to safe and stable housing plays such a critical role in preventing ongoing homelessness and difficult situations and other circumstances facing the young people who we serve. So just to give you, just to touch on the Let's Talk Runaway Prevention curriculum, which I had referenced, this is again, it's accessible on our website. It's module based. You can download all of these modules. You can download and use them individually. You can use them in a variety of different ways. They focus on a range of different topics. Maria Taylor, who I referenced earlier during our introductions, is available and accessible in terms of providing technical assistance and support and ideas around using the curriculum. We do want to note it's available in both English and Spanish, and it's really targeting a pretty wide range of age groups and audiences. We're pretty excited right now. We're in the midst of actually doing a full update to this curriculum, which will be, again, available toward the end of this year. It's certainly, that has more to do with sort of updating the look and the feel and making sure all of the resources and information obviously are current, and adding some additional information that is important now to add a few years after this curriculum was developed. But again, we really encourage you to take a look at it, to use it in different ways. And we are happy to share examples or provide connections to other organizations that have found great success in using this. So I think it's now time to turn it back over to Jeff.
So the next thing we wanted to kind of get to is how we might be able to more directly serve you all or partner with you all, especially different runaway and homeless youth organizations. And the first thing that we wanted to take you through, which is quick, and hopefully many of you have seen it. We have a new 1-800-runaway.org, and shout out to Catherine, who's on the call, who did such amazing work in building this and continues to do so. And we're really proud of the site, and of course we continue to develop it. Websites are something that's never complete. It's always a live document, I always say. But the idea of this site was for it to be easy and the navigation to be very clear for all users. And the idea of it being that it's meant to serve multiple users. So whether that be youth, concerned adults, and service providers, there's information on those pages and resources available for all of those groups. Hopefully you'll agree. We think it's modern and very visually appealing. Our primary goal is for it to be appealing to youth who might need our services. Again, along the way with building this site out, we really did a good hard look at the content that we had on there, which we updated, we streamlined, and made it, I think, much clearer in terms of organizing the content by what group you categorize yourself in, who we might be trying to help along the way. We hope that our resources and the information is easy to access, and very importantly, especially for youth who might be checking us out on their phones, it is a mobile-friendly site. So just wanted to show you a few parts of the web page. On the next slide here, you see essentially our home screen. And as you can see along the very top, which stays with you, are quick buttons to reach us, whether it be by hotline, by chat, or other method, email, and so forth. And then as you can see on the blue bar there at the top, very easy to access drop downs based on who you are and what you're looking for, right? So if you're a youth, you probably drop down that first menu, and then parents, legal guardians, and such, and next, and service providers. So there's a lot of resources there. And then as you can see, some of the graphics that we use, and these larger buttons to get to the different means through which you can reach us. I wanted to highlight just a couple pages in particular. Here, while this may look a little bit confusing, just imagine that what you're seeing on the left side is the top, and then on the right side there would go beneath it. So if you were to walk through the page, our prevention and education page, this would be vertically aligned here for you. But as you can see, there's a whole lot here through the prevention and education tab. There's opportunities to take a look at a big social media campaign that we continue to pursue and will be building back up, in fact, related to our reaching out to youth directly through social media. And then more information on National Runaway Prevention Month, which I'll talk more about at the end here. Events calendars, outreach materials. Again, we'll talk a little bit more. Direct access to the prevention curriculum and this runaway quiz. So all these things, we'll get into many of these again, but these are all right there if you click on that prevention and education tab. Next slide. So similar, I just wanted to point out kind of the service providers tab, guessing kind of who the audience is here today. This tab, same deal, where this would be kind of the left side, and then the right side fits beneath as you go through the page. There's opportunities to partner with us. Hopefully many of you are part of organizations who are already resources and referrals that we use if youth reach out to us locally within your community. If not, we want you to be. That's something we definitely can do relatively easily with our resource specialist. Where we have training opportunities, we post those here. And then any technical assistance and FAQs, of course, we're easy to reach, and we can get questions on to the right folks along the way. So those are just some examples of the page. We, of course, welcome you to look more fully through the website and reach out to us if you're not finding things directly. We are easy to reach. And I'm going to turn it back over to Susan just to point out a few more ways that we might partner together, and where we might help you along the way to get data and things like that might be useful.
Thanks, Jeff. And then just a reminder to folks, I did just put a note in the chat just a few minutes ago. If you have questions or want to know more about something, please feel free to chat away. We'll either answer as the presentation's going on, or we'll make sure that we pause at the end and respond to those questions. But we do want to know what you're thinking, and making sure that we're making this presentation also addressing anything that you might have hoped for or that you might be looking for as well. So want to just take a minute to note that if you feel like having conversation. As Jeff mentioned, we did want to highlight just a couple of ways and opportunities that we please we really encourage you and please ask you to please take advantage of as we work together. But one of the really key ways as we work with our partners and agencies across the country is that we have data that we really feel can be very helpful, whether it's just to give you a idea of what's happening in your community. Please keeping in mind that this is from the perspective of who may be reaching out to the Safe Line, and then reflecting back, we have agencies that reach us who maybe are working on specific grant applications, and this data can be helpful to inform some of the work that they're doing. It may influence reports to whether it's funders or board members or other people in the community. So please feel free to consider this. This is a sample of a snapshot that we put together. Jeff had referenced that we've been having some conversation with some folks in South Dakota. This was a snapshot of looking at the data from both North and South Dakota. This is what we sent to them. So as you can see, it's super easy. It's in this beautiful format that our communications team has worked so hard to put together, but we can build this out. It just gives you a sense of some of the different kinds of things that you can come to us or work with us, and we are happy to put together to provide. So this is one option just around, again, the kinds of data that really spells out the demographics that may be specific to a state. We can drill down at times to specific cities or communities, but keeping in mind, it really depends and ranges. The numbers might sometimes make the data not as useful, depending just on the size and scope and the range of the size of those communities. So if we move on to the next slide, the other piece, and we've kind of touched on this earlier in the presentation, I know that this is a lot to try to look at. We were trying to sort of squeeze in every ounce of information we could possibly share with all of you because we're just so excited about some of the things that we have to offer. Again, Jeff, using sort of Jeff's piece, we did take a little bit of a snapshot picture of what the website looks like. It doesn't quite look like this. It's more of a vertical look, but to give you an idea of some of the materials that you're able to go on and order. So we've made it super easy. You do it online, and we're very quick in terms of that turnaround, but we do mail all of these different resources for free. So please take advantage of those items. If we flip to the next slide. So we've mentioned a lot the resource and referral database that we operate. One of the ways that we build out and make sure that we build out that database, but then also make sure that we are referring young people to the services and supports that are available in their respective communities, is we're also dependent on all of you for being a part of that network of services. And one of the things that we've done, particularly improved this, I believe, over the last year or so, is to make it much more easy to do this digitally or online. So previously, it was sort of a much cumbersome sort of paper snail mail based process. It's super easy. You click, you get onto our website, you submit the form, and then our resource specialist on the other end is helping to walk that through our process. You get listed in our database, and then we have this memorandum of understanding or agreement in place where we're able to work together. Some of the things that also helps us do is particularly, let's say, around home free, when we're really trying to understand and figure out where the young person is going and how we kind of navigate all of the different steps that takes. When we have an existing agreement with an agency in our database, it means that we're mutually agreed that we're working together. We've mutually agreed that we know what one another does. We understand the services and supports that are provided. And so this helps oftentimes to streamline those relationships. It also makes sure that when a young person reaches out to us from a specific community, that we're not missing a critical resource or support that might be available to them to access. So I think there was a question. Okay, so Nikki, we'll get to that in a minute. Yeah, sorry, but a good question. If we move, I think there's one more slide. So I don't know what slide, what number actually is this my last slide? Sorry.
It is. We have
Thank
one more slide afterwards I was going to touch on as well.
Nice. Okay. So just to kind of summarize and just focus, here's just some additional ways that we're excited about working together. But again, we've touched on the Let's Talk curriculum, but I also just want to note, it's not just something that you go download and then you're kind of on your own in navigating it. We do have staff in place to help facilitate that. We do offer throughout the year, and we will be offering this again, a facilitators training in terms of how to even use the curriculum, how to teach others, maybe in your networks to use that curriculum. We've learned all kinds of best practices, ways to be super innovative with it, particularly over the last year and a half with the pandemic. We really try to offer as many training opportunities as we can. We have an entire team who's dedicated to training and quality assurance components of our work. But whether we do something specific that you're looking for within your organization, but also offering these kinds of seminars, webinars throughout the year. So it's a great way to, if you're not already doing so, to sign up for our regular monthly newsletter, which always highlights different activities, different resources, different things that we're organizing through the National Runaway Safe Line. We're always updating and have new ways and great information that's available under the same topic on our website. And then finally, really, really important is our National Runaway Prevention Month. We have an entire series of national activities along with local recommendations for local ways to celebrate and honor and use National Runaway Prevention Month, both as a way to shout to and highlight and share out the importance of the issues and the challenges facing runaway and homeless youth and youth in crisis. But also we offer all kinds of, again, resources and materials. We have a toolkit that is sort of the nuts and bolts and offers everything from how to put on ideas for events to how to work with the media, to sample proclamations to send out to your local, and state legislators, and just ways to get engaged. And we're also very excited about what we've added, which is a youth-focused toolkit and a youth ambassador program, which is really focused again on gearing and geared at ways that young people can be engaged in the work that we're doing, engaged in National Runaway Prevention Month, but also ways that youth, the youth community can be involved in really using their voices also to amplify the conversation and to weigh in and to give their input, their thoughts, their ideas, and their feedback on what we are doing as well. So with that, I will turn it back over to Jeff.
Yeah, I'm just going to piggyback exactly on that, just to invite you all to participate in National Runaway Prevention Month. And we are excited and are building out this month as we speak. We would love for you all to consider being partners. You can be part of an organization or a company, or you can join as a partner, as an individual. All these things are possible to help us shine a light, as we say, on the issues that face runaway and homeless youth. As you can see, what we do is we try to help people understand what they can do and different elements to consider, helping us to shine a light through what we call partner calls. We'll offer 5 leading up to the event in November, with 1 in August, 1 in September, and 3 in October on a range of different subjects, with the first one being on Thursday, August 19th, and it's kind of going to be an NRPM 101. So if this is new to you, that's a perfect thing to add to your calendar. And of course, we'll provide further details and Zoom links as these things approach, probably through the method that you found out about this call today. We mentioned some of the goals already. We do invite you to visit the page. As we said, we are building this out as we speak. So this page will become more and more robust as we build this out. But there will be toolkits as we finish them up. Commitment cards for you to show your commitment and support. We'll offer social media graphics for you to provide and to post on your own personal and professional pages. We'll have a schedule of national events there, and then invite you to join us in activities, whether it's to add a background to your Facebook profile picture, to join us for our Twitter chat, wear Green Day, as green is the color that we have for National Runaway Prevention Month. We'll have a lunch and learn series, which was extremely successful last year, and we're excited about. And even a light the night community events, and we'll see buildings lit up in green. We invite you to try to do that in your local community as well. So a lot of details there for sure. The website's a great place to find out about that, but we would love to invite you to partner with us on that as works best for you and your community. So with that, we want to leave, we have 5 minutes left. If we go a few minutes over answering some questions, that's okay. But we definitely want to answer any questions that you may have. We had a great question in the chat, and Susan, I don't know if you want to potentially tackle that. The question was related to our home free program, and whether a grantee needs to have a police report for a youth to qualify for the ticketing process through that.
Yeah, so thanks, Nikki, for raising that question. We have made some changes to the Home Free program over the last couple of years. So just to kind of quickly walk through, and I think Catherine may be hopefully posting a link to the Home Free information on the website, just so folks can access that. But essentially just a couple of key points about the Home Free program. One, it is a youth initiated program. So in order to be ultimately go through that process and to be issued a ticket, it is really critical that young person does have to initiate the process with the Safe Line. I only note that it doesn't preclude an agency or organization or service provider from reaching out to us to ask questions and to sort of vet the process before we might speak with the young person. But it is youth driven. It must begin and sort of end with them. In terms of the kinds of documentation, essentially when they reach out, our role and what we do at the Safe Line side is sort of understand better what's happening with the young person, maybe what prompted them either to leave home or what the goals are and sort of the decision around where they're trying to get to, understand that better. Facilitate a conference call either with the parent or guardian on the other end, or it might be an alternative other kind of living arrangement, maybe another program or service provider. We're just facilitating that, ensuring that everybody's on the same page, that everybody has the same expectations, etc. And then in terms of documentation, well, yes, previously in our previous history, we absolutely for young people under the age of 18 required a police report to be filed. We no longer require that. We do still inquire about it, just because in the event that a report has been filed, it's just important for us to understand or see that documentation. I'll give just as an example, I know of one circumstance we had where just the police report noted some very serious mental health concerns and mental health issues for the young person. So that helps us just in the planning and the conversation and in the sort of transportation process. We do ask for identification and different kinds of documents just to both confirm that the young person is who they say that they are, as well as that the person on the other end is connected to that young person in some capacity, and they are also who they say they are. There's much more details to this and process, but that's just a little bit of, hopefully, Nikki, that at least speaks to your question. And I know other people sometimes have those questions as well. And certainly we're open to other questions. If either you want to speak up and turn and unmute yourself or post it in the chat, we're happy to respond.
I'll just add that we will post this recording on the registration page where you registered for this event, which is just 1-800-runaway.org/NRS webinar. So if any of your colleagues might be interested in this, or you want to share this with anyone, this will be embedded on that page for you to share with others.
So if at any point you have questions, you want more information, you're looking for other resources, please don't hesitate to reach out to us and our team. We're always happy to respond, to answer, to partner, to work with you, to support you in ways that works best. So we so appreciate your time and for your being with us. We really appreciate it today.
Thank you all.